Hi all, let's talk about tinnitus. MyLove1618 posted a comment requesting more information about how you can most effectively use a TENS unit to treat tinnitus. And this is an interesting question, and it's going to vary depending on what type of tinnitus that you have. I would be happy to do a longer video showing some different options for where you can place electrodes to see if you get improvement with using a TENS unit in a more standard way. But I wanted to do a short video today just talking about what the research says about using a TENS unit for vagus nerve stimulation and how that can help with tinnitus. And so there are definitely more research needs to be done here, more robust studies. But what they most often find is the most effective is combining the vagus nerve stimulation with sound therapy. So this is that targeted plasticity idea again. So using the vagus nerve stimulation and then having sounds, different tonal sounds playing in the ear at the same time. And most often what they find is that it's when they do tones that are different than the tone that you hear with your tinnitus that they find the most benefit. And they've done case reports and small studies on this and see pretty good results. Both with transcutaneous, so through the skin vagus nerve stimulation, as well as when they've done the implanted devices, the surgically implanted devices. And so they see decreased severity of tinnitus and decreased distress. So a lot of the time tinnitus can cause depression, poor sleep, anxiety, concern about, just being able to participate in life because sound can be really problematic. Loud sounds can be problematic when you have tinnitus. And so they find that people's anxiety improves, their depression improves, their sleep improves when they're doing vagus nerve stimulation, and that the tinnitus itself improves when they combine the vagus nerve stimulation with the tonal therapy. What's also really interesting is that they've done some studies where they've looked at auditory cortical activation. So this is the area of the brain that lights up when the brain is processing sound, when you hear sound. And for those with tinnitus, the auditory cortical activation is increased. So there's more activity in the auditory area of the brain. And when you just do transcutaneous vagus nerve stimulation, the activity in the auditory region, cortical region of the brain is decreased. So again, some good concrete neurological evidence to support that vagus nerve stimulation is useful for treating tinnitus. Comment again, let me know what other conditions you would like for me to take a look at. I'm Carissa Conrad, Doctor of Physical Therapy, Therapeutic Pain Specialist, and I am the Vagus Nerve PT. Thanks for watching.